Assalamu alaikum. Thank you very much for participation in this Medicare 101. So this is a understanding the A, B, C, D of the Medicare. In this presentation, I'm just showing history of the Medicare, Medicare eligibility, what Medicare cover, your Medicare options, important dates, cost and more. What is Medicare? A federal health insurance program to eligible US citizens and legal residents funded in part by the taxes you pay while you're working. It is an individual health plan. It is not a family health plan, not a social security, not Medicaid, and not free. How long have you Medicare been around? Somebody have an idea?
I'm gonna guess. I'm gonna say 1975.
It's 1965. In 1965, President Lyndon Johnson signed the Medicare into law. Harry Truman and his wife were the sign of the first Medicare beneficiaries. Medicare is available to United States citizens and to legal residents who have lived in the US for at least 5 years in a row. You are age 65 or older if you still continue to work. You are under age 65 and have a qualifying disability such as end-stage renal disease. Medicare have a 4-part. Part A is only for hospital insurance, Part B is for medical insurance, and Part C is Medicare Advantage. Part D is prescription drug coverage. Original Medicare Part A and B offered by the federal government, also called Original Medicare, cover much of the thing but not all of your care and generally has a deductible and co-insurance. Part A helps cover hospitalization, skilled nursing facilities, hospice care, home health care. Part B covers doctor appointments, outpatient care, preventive service, occupational physical therapies, home health care. True or false? Medicare has an annual maximum out-of-pocket limit. True. It is false. Yes. Good. That is why you may want to look at a Medicare health plan like Part C or Medicare supplement plan to help with the cost original Medicare leave behind. Medicare Part A inpatient hospital have a $1,676 is called deductible, and it is you have to pay day 1 and it is covered up to 1 to 60 days. If you are staying in the hospital, it will cover that. After 61 to 90 days, you have to pay $419 per day. After 91 to 150 days, there is a lifetime 60 days coverage. Not every year, there's a lifetime. You can use it and you will pay $838 per day. After 151 days, you are responsible for 100%. Medicare will not cover after that. Part B is medical. Has a standard monthly premium amount pay to the Social Security, and if you have a Social Security, it will deduct it or you will pay. Higher income household may pay more. They have a minimum premium like in next year 2025 it have $185, and if you have a making more money, so it will be increased up to more than $600 per month. Is Part B premium. There is annual deductibles. This can increase each year. After meeting the deductible, Medicare pay 80% to cover services and you are responsible for 20% copay insurance. Everything you go to the doctor, you go a lab test, whatever it is 20% you have to pay. Service not covered by the original Medicare. Yeah, if you can have questions, you can ask there, or we can wait at the end.
I have a question about
Yeah, sure.
So, your earlier slide, you mentioned medical parts, Part A and Part B.
Yes.
And they both mention different services.
Yes.
Right?
Yes.
So, people even have an option because, you said the Part A covers hospitalization or Part B covers this.
Yeah.
Do people even have an option? Because it's
No, it's standardized. This is by the federal government.
So if I get Medicare, I get both Part A and Part B both.
Yeah, there's a Part A have a premium free, that one. And that premium when you are working and you pay Medicare taxes. So Part A is premium free. If you work 40 credit hours, the Part A will be free. But Part B is not free. Everybody have to pay premium. That is Part A and Part B. The Part A and Part B is not covered. Custodial care, hearing aid, hearing exam, routine eye care, eyeglasses, except for the one pair for the after the cataract surgery. Most dental care, dentures, healthcare received while traveling outside of the United States, except in limited conditions. Part C is called Medicare Advantage. Part C, Medical Advantage, also known as Part C, is offered by private insurance companies and may include extra benefit including Part D prescription drugs coverage. Part C help cover everything that original Medicare Part A and B covered. This included. Some plans include additional services that go above and beyond the original Medicare. Medicare Advantage is required to provide an out-of-pocket maximum. The original Medicare and Medicare Advantage have original Medicare don't have a maximum out-of-pocket, but Advantage have a maximum out-of-pocket. Medicare Advantage. When choosing Medicare Advantage, instead of staying with original Medicare, you must have both Part A and Part B. You may have to pay an additional monthly premium for the Part C, but some plans offer zero premium. You remain a Medicare member as long as you keep paying your Part B premium. So for that, you must have to be pay Part B premium. If you not paying Part B premium and Part B will drop, then automatically Part C will be cancelled. Some plans have built-in extra benefit above and beyond the original Medicare, and some can purchase separately depending on the plan. There is a different type of Medicare Advantage plan. Most common is HMO, PPO. HMO have a fixed network. PPO have you can go to any provider, but if you go out of the network, you pay more for that. And there is a PFF, the personal fees to service is very, that plan also have a different, and there is a special need plan. This is special need plan for those people have a chronic conditions like a diabetic or heart condition, and some people have also Medicare and Medicaid. So that plan is good for them too. Part D is a prescription drug plan.
How do we have Medicare and Medicaid?
If you have a low income, you may qualify for the Medicare also. So there is a limitation for the asset and the income and family size, whatever, they will qualify you. Part D plan are required by federal law to offer the basic benefit offered by the Medicare. Part D is a private insurance company contracted by the federal government. Each Part D plan has its own list of covered drugs called as formulary. Choose the one that include medication you take regularly. Not every Part D plan have a different formulary. It depends what medication you take. So it has to be considered when you are selecting the Part D. Part D prescription. You usually choose Part D in one or two ways. A standalone insurance plan you buy to help cover medicines. Like if you have a Part A and Part B, you can have to purchase the Part D to cover up the prescriptions, because the original Medicare Part A and B not covered the prescription. That's only medical and hospital. Or as a part of Medicare Advantage plan is also called Part C, that include also Part D. So you don't have to buy separate, you have to buy only one. Part C include A, B and D is included in one plan. If you enroll in Medicare Advantage plan Part C with Part D drugs coverage, you don't need to sign up for standalone Part D prescription drugs. If you are in Part C, then you cannot enroll in Part D. If you enroll in the Part D, your Part C will be cancelled. If you decide not to join a Medicare prescription drug plan Part D or Medicare Advantage plan Part C with Part D prescription drug coverage when you are first eligible and you don't have other credible coverage or get extra help, you will likely pay a late enrollment penalty if you join later. So if you are turned 65 and you are healthy, you not enroll in the Part D, later stage when you will join, you have to pay the premium plus penalty, and it is forever. There is a new law passed in August 16, 2002 by called Inflation Reduction Act for Part D. The IRA Act 2000 includes several provisions to lower prescription drug costs for people with Medicare and reduce drug spending by the federal government. Ultimately, it aimed to address high and rising drug prices for consumer and cap out-of-pocket spending for Medicare Part D enrollees and make other Part D design changes which begin in 2024. The some effected in 24, but the biggest change comes in next year, 2025. Part D changes in 2025. This is the biggest change in the history of Medicare. That is cover up to the maximum out of pocket for drugs anybody can pay is $2,000. In 2024, somebody can have to pay up to $8,000. So next year, there is a big relief for the Medicare beneficiary who have expensive medication taking, so they are capped the cost for up to $2,000. In 2025, there will be only three phases: the deductible phase, initial coverage, and catastrophic coverage. Medicare beneficiaries in Part D plan with relatively high out-of-pocket costs are likely to see substantial out-of-pocket cost saving from these changes. The bottom line, drug manufacturers have to pay more, Part D plan have to pay more, Medicare beneficiary members drug cost decrease. Part D changes in 2025. There is three phases. The first is annual deductible. The annual deductible is $590 for 2025. That is the maximum insurance company can charge you. But they allow you can charge less, but the maximum they can charge you. And then after the $590 you pay first $590 for prescription you buy. After that you are come in the initial coverage period. In initial coverage you pay 25% of the cost. 75% of the cost covered by the Part D. And once you pay $2,000, you are in catastrophic coverage. You pay $2,000. After that, everything is $0. Yeah, drugs. Only drugs. That's only because they are three parts have a different coverage, as I mentioned earlier. This part is only up to the drugs, not medical. As I mentioned, is not free here. Medicare Present Payment Plan, new in 2025. There is a big change also. This is the new first time. This is beginning 25. The RA require our Medicare Part D plan to offer enrollee the option to pay out-of-pocket drug costs in the form of capped monthly installment payment instead of all these. Like that one, some people have expensive drugs. So instead of first month they are paying $2,000. So you can divide this $2,000 in 12 installments. So you will pay monthly. You go to the pharmacy, you're not paying any co-payment, and the insurance company bill you monthly the cost, and you will pay. And for this option, your drug cost to be estimated be minimum $600. If your drug cost is less than $600, then you cannot enroll. But if you have a $600, you can pay $50 a month for 12 months. The Medicare prescription clause, they have a 6 things. Provide members with option for pay out of pocket. It help you. Okay. Intended for member with high cost of pocket. You have to streamline your expenses. For every pharmacy type include retail, mail order, home infusion, specialty. Is not how you get your medication, but all is covered in this option. And it is voluntary. Not everybody you have to enroll on this. Has no cost to participate, doesn't save money or lower your drug cost. There is no benefit, only you have to pick a payment plan type things. Opt-in method, phone, online or in writing. When opting in period to the plan year starting, you have it 10 days to process. But when opting in during the plan year, you have it 24 hours to enroll. You can in and out as you like. How to enroll in Medicare? Original Medicare enrollment period, also called initial enrollment period. This is the 3 months before you turn 65. You can enroll. And your coverage will start the month you turn 65. Whatever the date, regardless, you will be start coverage for the first of the month. No. You can enroll, but without automatically you cannot enroll. You have to apply for that. And after
the online audience, that's why I'm using mic, so online audience can hear as well.
Yeah.
So I'm just going to repeat the question.
Yeah.
That once you reach the age of 65,
yes,
you need to be able. You need to enroll yourself. There's no automatic enrollment of any kind. You have to go certain website and you have to sign up.
Yes.
Okay.
Yeah, but there is one thing. If you are already taking Social Security before 65, then they will send you the card when you turn 65. But if you are not taking Social Security, then you have to apply to the Social Security. Then there is a penalty. No, this is a 7 month is no penalty. First, the turning 65, there is 3 months before and the 3 months after 65. So if you not enroll in that one, and also there is an exception I also explain you in the next slide, but this is the time, like if you are turned 65 today, like in December, if you apply now, you can coverage from the first of the next month. But if you are going apply in the February, that's your third month, and then the coverage will start from the March 1st. When you apply, the next coverage will start on the first of the next month. Original Medicare enrollment period, a special enrollment period also called, allow an individual to enroll in Part B at a later date with no penalty. To be eligible, you must have certain conditions. What conditions? Enroll in a group health plan continuously after age 65. Like you working, your health plan is continue covered by the employer, then there is no penalty. You or your spouse were actively working for that company. If you are turning 65 and your wife is working and you are covered, then there is no penalty. Must enroll within 8 months of your employment or coverage ending, whichever occurs first. Once your employer coverage ends, within 8 months you must have to enroll in Part B, otherwise there is a penalty. Only three conditions will not pay any penalty. How to enroll in Medicare? Original Medicare enrollment period is called general enrollment period. Like if you miss your enrollment period, 7 months, then you have a next chance, you have a January 1st to March 31st. And when you will enroll the next month first your coverage will start. Yes, if applicable, then there is a penalty. No, it's a lifetime penalty. Yeah, it's a 10% penalty and it is a lifetime. Yeah. Because they don't want to, you can skip that one. Did not enroll during the initial or special enrollment period, have dropped Part B and wish to re-enroll. Like you enroll in Part B and somehow you not pay the premium and you drop it, then you have to wait for the next year. And 10% penalty for every year you were eligible. Yes, Kasha.
One question over there is a lot of us are immigrants.
Yes.
And a lot of us parents when they come in, right? So parents are usually already near or already crossed the age of 65 and they have never worked here.
Yeah.
So the question is, can they enroll in Medicare?
No. Medicare must be, you have to be work 40 credit hours in the US. It's not continuous stay in the US. Once you have work 40 credit hours, you will be qualified for Part A and Part B. Yeah, every year you pay Social Security tax. So you earn 4 credit hours every year. So it means 10 years. If you working minimum wage for that, you will be earn 4 credit hours. But if you earn less than minimum required amount for the 4 credit hours, you get less. You get 3, 2, whatever it is. But there is a minimum requirement for the income, or you have $1 million, there is the same 4 credit hours per year. Original Medicare enrollment period. Okay. Your Medicare coverage choices have 2 options. Part A and Part B, these called Original Medicare. And you have 2 options. On the left side, it is a Medicare supplement plan or Part D. So you must have to be enrolled Part D. Part A, B, D is mandatory. You cannot avoid D. But the supplement is optional. The supplement, what they do, they cover what is the deductible and out-of-pocket cost for A and B. The supplement will cover that cost. But there is a premium, is not free. You have to pay premium for that. And for that, you have a guaranteed period when you turn 65, within 12 months, you can have a guaranteed period. Whatever your health condition, no company can deny you. But after 12 months, if you apply for a supplement plan, then you go underwriting or depend on your health. They are not guaranteed. Other option, you have a part A and B, and you opt in for the part C. The part C cover A, B, and D. So it will cover part A and B and C, and that part C also have maximum out of pocket. Like original Medicare, there is no limit, but part C have a maximum out of pocket. Medicare supplement. Medicare supplement plan, also called Medigap. These plan offer called Medigap work with original Medicare. No, it is for people who have after 65. This is Medicare, is a federal government program. Obamacare is who have age before 65.
That you want to use?
Yeah, so my question was, is this the same as Obamacare or something else?
No, it's different, completely different.
Okay, thank you. So you said so this is for those who are
Over 65.
over 65.
Over 65.
Okay, those who are below 65, they will.
They have a separate plan for that.
plan for.
There is a separate thing.
Okay, thank you.
They are designed to help pay for the cost original paper doesn't pay, such as co-payment, co-insurance, and deductible. Each Medicare supplement insurance has a unique blend of benefits. They may be attractive because they are not limited to a specific network. The supplement plan, you don't have to worry about the network. You can go any doctor or hospital, they accept Medicare. So you don't, like a PPO plan, HMO plan, you have to stay in the network to cost. But supplement have a same benefit if you go to the any doctor or hospital, then you can cover it. 10 plans will standardized benefit for federal government. The federal government have a standardized coverage for that. Plan offered by private insurance companies in your state. Every state have their plan. These are the 10 plans have. The most, because some plan is not available to people turning 65 this year. So currently there is only 2 plans available. It's called Plan N and Plan G. So this by the modified something is changes, but currently the people have a Plan N and G. Yeah. Plan F is not allowed, but people have a Plan F before they close that plan, so they can still continue, but new people cannot enroll. What is the difference between Advantage and Supplement? Usually, Advantage plan has a network for the best cost saving. Like HMO is the cheapest, PPO is little expensive then. Medicare supplement can go to any provider or facility that accept Medicare. Usually include Part D coverage in Advantage plan. But in supplement, do not include Part D coverage. You have to buy separate. Benefit must be as good or better than original Medicare and may have include extra benefit like dental, vision, and hearing. Benefit are standardized across all plan premium. May be subject to underwriting if you are outside your guaranteed issue period. But Advantage plan have a guarantee. Insurance company cannot deny you. Whatever plan you want to pick, they have to enroll, whatever your health condition. Subject to enrollment period, but there is an enrollment period you can, but for supplement period is open for year around. You can enroll any time in the year. Must be enrolled in Part A and B, And supplement also, you must have to enroll in Part A and B. Enrolling in Medicare Advantage, called initial enrollment period, if you enroll in the 3 months before your Medicare effective date as age 65, your plan effective date will be the first day of the month that Medicare is effective. Otherwise, the plan effective date will be the first of the month, your 65 birthday, and only 3 months after. If you are Medicare Advantage, Medicare plan before 65 for your disability, you will have a second 7-month IEP at age 65 when you are changed or enroll in MAD plan. These are the dates for enrollment periods in here. The currently we are here is called annual election period. October 15 to December 7 for every year. So that date you can have change plan, switch plan, go to the back to the original Medicare or change the carrier. This is open, you can pick that one. And special enrollment period also. Generally outside of the AEP, you can only make changes to your plan due to special conditions like moving out of your plan, service area, leaving an employer group health plan, or have Medicare and Medicaid. Yeah, but if you have a job, no, you must have to be enrolled in Medicare. Yeah, if you don't have a job and your social security is not enough to qualify you, then you can also get a Medicaid also. You have to apply for that.
So after Medicare, we have to apply for social security.
Yes, up to you, it's optional.
Don't apply for.
No, it is up to you. They are not forcing to apply for social security.
Apply for Medicare and then job and apply for Medicaid also.
Yes. Yeah. Medicare Advantage annual open enrollment period. The Medicare Advantage open enrollment period offer MA and AB members to change their plan if they feel a more suitable options in after January 1st. So between January 1st to March 31st, they can switch. Like somebody enroll in October, November, and in January and February they find out this not, my doctor is not in the network or I need more things, so they can switch plan. But after March 31st, you are locked in. You have to wait next October to change or go back to the original Medicare. It is time to make a Medicare choice. You have to consider these 5 things: your cost, your benefits, your convenience, your need, your providers. It means the most important thing, you have to look your doctor, your prescription is covered in the plan. Most important things. And you have to care for the past few years, how do you anticipate your medication needs, change, increase or decrease. There's a convenience. Are the plan in network provider conveniently located? You have to, these are the most 3 things you have to, and the benefits what the plan is offering is suit your need. And the cost also, because every Advantage plan have a different cost and different benefits. So you have to look what is the balance of whatever you are getting. Think about your need over time. What health history? Do you have a chronic conditions? Will your health need grow in the near future? Your prescription drug. If your prescription drug is spending increase in the future, Medicare Part D may have lower cover the cost for you. Need more coverage than Part A and Part B. A Medicare supplement insurance plan or Medicare Advantage plan may help to cover some unexpected healthcare cost. These are the helpful resources. If you want more information, you go to www.medicare.gov. You can explore the option, or you can call 1-800-MEDICARE 7 days a week, 24 hours. Also, you can call the state health insurance program or go to the website for the state insurance plan, or contact your local Social Security or Medicaid office. They will help you. Thank you for your time and attention. We hope this helped you as to consider your Medicare coverage option. That's my contact information. Sayyid Qamar Medhi, 630-550-1011 or sayyidwfg@gmail.com. You can call me or email me if you have a question or need help. I'm here to help you what you need. Yeah, it is an individual thing. For that reason, we have to make a one-to-one appointment because everybody have a need different. So every point situation, this is a confidential information for your, so it should be one-to-one. Then we can find out whatever. If you want more information, there is a form there. You can fill your name, your contact information, and then I will contact you and we can make an appointment one-to-one. And my office, right now I'm working from my home. Before my office in Bloomingdale, in Elgin. Yeah, I can come to make a meet where you want. You can conveniently locate it. You can come to my house. I can come to your office. Where you want, we can meet. Suitable.
There is one question from online as well, and then I also have another question. The question from online is, how do you know that if your doctor, for example, someone is, today someone is working and they have insurance through their work, and then soon they retire, and then when they retire, they are looking for Medicare.
Yeah.
So the question that came in from online is, how do they know that their existing doctor, because they like the doctor, they're not a Houston doctor, how do they know that the doctor will be available or not?
They have to make an appointment, one-to-one appointment, and we can discuss what their need, what their doctors, what their prescription, and find out which plans suit best for them.
Is this something they can check online, go somewhere and find out?
No, you have to be talk with the licensed insurance agent to talk one-to-one. This is not a public information. You can get that one. Or you can go to the Medicare.gov and you can look, the plan is also, the plan information is all available on the Medicare.gov, all the information, but it is very complicated things. For simplify, have to make an appointment. There is no cost for that to make a command and no obligation to accept whatever you need. So I can analyze all your needs, current needs, future needs, and we can select whatever the best for you. And you are the person who can have to choose whatever. And every year you can have changed that one if you need to.
Thank you. And the second question is that you mentioned the different plans, different prices.
Yeah.
So are there any fixed costs from the government perspective, or is it?
No, government is the Part B, they're paying 80%. Regardless, you have $1 million bill, you are responsible for 200,000, whatever. So your share is 20%. To make an unexpected big bill, so you have two options. You have to buy the supplement plan or enroll in the Part C. Then you know what is the MICA's coverage maximum out of pocket for a year. And every Advantage plan or Part C have a different maximum out of pocket, depend on the whatever benefit.
And Part C is the gap insurance?
No, Part C is Advantage plan.
Advantage plan, okay.
The gap insurance is called supplement insurance.
Understood. Okay, so the Advantage plan and the supplement insurance.
Supplement insurance.
So their costs will vary depending upon your current.
Yeah, depend on the
Understood.
Yeah.
Part B, you have to buy compulsory.
Part B, you have to enroll must. There is no option.
You pay only 20% for what your hospital pays.
No, not the hospital. Hospital, I say $16.76 one day. If you are admitted in one day, you are responsible for $16.76 up to 60 days. But after 60 days, you admit again. Yeah, then you have to pay again. For that, you have to be protect and you have to choose Part C or supplement insurance. So that is the biggest thing you have to decide. I'm here to explain people to have to be protect the things. Yeah.
76 per day, then it goes up after.
No, after 60 days, like, there is a per day. Go back to it. Let me. Yeah, I will show you. Yeah. Yeah, this is the part A. It's for hospital. You stay, you go hospital. Day 1 or 60 up to 60 days. You are responsible for 1676.
No matter what, Medicare.
No Medicare, whatever it is. If you are in original Medicare, Part A, that's the federal government cover up to. And after 61 days, you pay $419 per day, up to 90 days. Yeah. No, 1676 is one time for 60 days, no per days.
Oh my God.
No, one time. But yeah, but after 60 days you go, you again pay.
$490 for 90 days.
No, like you stay 5 days, okay, and your comes out, you pay 1676, okay, and after 60 days you again go to the hospital. You have to again pay $1676.
Up to 60 days you stay,
Yeah, then there is same cost.
again you have to pay.
Again you have to pay. And if you stay longer, 60 to 90 days, then for 60 days it is 1676, but 61 to 90 days you pay $490 per day.
Okay.
How many days? Over the 60 days. Yeah, yeah, every year. But there is also 60-day lifetime, not every year. Every year you will cover up to 90 days, this one. But if you stay more than 90 days, then you will pay $838 for 91 to 150 days
Per day.
per day.
Every day you pay.
Yes. And after 151, you are 100% responsible. The government will not pay anything. Yeah,
There's no other choice you have.
yeah.
You go bankrupt. So there's a other way you can come out.
Yeah, for that there's a two option I explained you. You have to enroll in Part C or enroll in get the supplement plan.
That you have to pay extra for the parts.
No, Part C, most plans have a zero premium, but I cannot disclose the things. But yeah, the Part C is like a cost, but supplement plan have a premium. You have to pay. You have to pay premium. No, there's a different plan, have a different coverage, and that's also discussed in one-to-one what is your need. Yeah. Yeah.
Right. Thank you.
Thank you.
So now I'm turning 65 after, so I have 3 more months to get the booked out.
Yeah, you can do it. Yeah, you can start your application today. That's to file for the.
I'll take a
Yeah, you make an appointment. Yeah, then we can.
one-to-one.
Yeah,
But
yeah.
one-to-one.
Yeah, it is a social security you have to pay to the government. Yeah, it's optional if you can pay. Most people have social security, they will deduct it or you can pay. Yeah. No, different, yeah. There's different. Eh? That's okay. Huh? Thank you very much for your attending this one. I will appreciate if somebody have question or people watching online have a question, they can call me or they can email me. I can contact him. or message me, then we will be in connect with them.